All right, childhood pneumonia is one of the leading causes of under-5 mortality in Nigeria. To tackle the killer disease, an NGO, Save the Children International, is exploring ways through which the media can contribute towards raising awareness on the matter. Arise correspondent Asmal Alwan reports.
Pneumonia is the #1 killer of children globally, as every 39 seconds a child dies from the infection, says UNICEF. It also accounts for about 15% of all deaths of children under 5 years.
The childhood pneumonia, it is actually the biggest killer of children under the age of 5. But very unfortunately, a lot of people don't know that, including policymakers.
The belief that it's caused by cold is also the reason why it's the largest killer of children, under 5 children in Nigeria.
In Nigeria, it has been reported that under 5 mortality rate is 132 per 1,000, with pneumonia being a leading cause. This is as a result of low immunization, especially in hard-to-reach areas, urbanization, malnutrition and pollution due to burning of wood in the country.
The childhood pneumonia, it is actually the biggest killer of children under the age of 5. But very unfortunately, a lot of people don't know that, including policymakers.
Awareness goes a long way, and that is why Save the Children International is holding a dialogue session on the media's contribution towards combating pneumonia in children.
A lot of effort is going on, particularly in Jigawa State, because what is happening is that there is a lot of awareness being created among health workers, and funds are being made available for treatment of cases of pneumonia.
At the end of the deliberation, it was agreed that government intervention and partnership with NGOs is key to addressing the scourge of childhood pneumonia.
Well, for more on this, let's bring in Dr. Isa Adamu, Chief of Party Inspiring Project Save the Children International. Thank you so much for joining us on Newsnight tonight. First of all, let's discuss how serious the issue of childhood pneumonia is in Nigeria. And that's assuming that we all know what pneumonia is. Maybe you want to even help us understand briefly before,
Sure, thank you for having me. And pneumonia is simply an infectious disease which affects all kind of people, but specifically affects the children. Actually, those are the extreme ages, those that are old and those that are very young, but more pronounced in children under the age of 5. As a matter of fact, this particular disease entity is the largest killer of children under the age of 5, if you are to believe all the statistics we see from most relevant causes. So it is really pretty much a serious issue in the country and also in the world. It has been the case for a long time now.
I'll probably add, because I don't think you heard it, or unless I didn't hear it, the cause of pneumonia. But you just take that in your stride. Right. Your NGO is addressing this issue. Number one is how? Are you alone in this, or are you collaborating with any, maybe the government or private organizations? I don't know.
Right, very good question. So this issue is so enormous and the magnitude is so high that no one alone can do that. You must partner with people, with government, with even the media, like what we did this morning. But in the country, there is a good communication and collaboration between Federal Ministry of Health and a group of coalition, I would call it, a coalition of the willing. We call ourselves the Every Breath Counts Coalition, or the EBC Coalition. This is a group where you find UNICEF, you find WHO, you see USAID, Malaria Consortium, Save the Children, pharmaceutical companies, professional groups like the Pediatric Association of Nigeria and many others. We formed a group and we did a fantastic job. We produced the first ever national pneumonia strategy. How do we guide the country on how to manage this problem, including prevention, including raising funding, including anything you need to know about that. So it never existed before 2019, but because of that collaboration, we were able to come up with the kind of framework that anybody would follow, and you can make a dent. So we are so proud that strategy was launched in the country towards the end of 2019, and in the very early part of 2020, we launched it in a city called Barcelona in Spain, and in the first ever conference on pneumonia, and Nigeria was very proud there. We were the only country at that meeting that had a comprehensive national strategy.
All over the world.
Yes.
That's amazing
yes,
to
we felt
note.
very proud.
But how has this strategy that you have laid out, both for government and hopefully individuals, how has it translated then since 2020 till date? And maybe you want to address that policy challenge that seems to be an issue.
The policy is actually an integrated policy. It was based on previous policies that have to do with child health. So the focal of that policy is how do we bring partnerships and how do we raise funding? How do we raise awareness? Because that is the biggest problem, if you ask me, of this childhood pneumonia. A lot of people don't really know how bad the situation is. Ask them which is the best or the biggest killer of children. They will not mention pneumonia. Even our mothers, the caregivers in the village, they don't really understand this. So a lot of the deaths that we quote, all the numbers we're quoting, they're actually happening in the villages, in the less privileged communities, in the remote areas, disadvantaged groups, and they go unnoticed because those children are voiceless, and most of them actually die within the first year of their life. Wow. So those who know about it are the parents, but the larger society doesn't seem to know a lot because this is not a celebrity that has died. It's not a major politician or influential person or so of that nature. So it's very little children that are voiceless. And that is why this my organization, which is receiving funding from GSK, we are trying our best to do all the approaches that we can to translate that strategy into action. Yeah. And we have started with just 2 states at the moment. We're starting with Lagos State in the south and then Jigawa State in the north. And we deliberately chose these very different states. One is a very urban state, it's a center of business, center of movies. Another one is a very rural state. So we want to see if our approaches can work in both Lagos and Jigawa. We feel we can expand to all parts of the country.
Good, fantastic. Right. What are parents expected to do? And, you also talked about the media. How about the media? What are parents expected to do? And how are you involving the media to contribute, to help you in your project?
I would start with the parents because they stay with the children every day, every hour, especially the mothers. It is important for them to understand a combination of symptoms. When they see in a child, they need to immediately go to the hospital and seek care. We're talking about things that are not very specific to pneumonia, but there are certain things that are very specific.
Well, what are the key ones?
So when you see your child having cough with very high fever for a long time, and you see them breathing faster than normal, then you see them having difficulty in breathing. There is another sign they call chest indrawing. You see as child is struggling to breathe, the chest wall is going in and out. That is a bad sign. That's actually a danger sign. Wow. So once a mother sees this, there is no time to waste. She has to go to the hospital. But the media, as you said, when you deal with an entity which is not well understood, which is not known very well by the policymakers, you will need a medium to help you send across the message. And that was the reason today we spent 2 days between yesterday and today talking with various media organizations, trying to tell them that, yes, we know what to do, but you guys have the voice, and we want you to help us send this message across. Maybe we could get a champion for pneumonia. do you realize we don't have a champion for pneumonia?
Well, I can assure you that you already, I can assure you have a champion already with Arise News.
Right.
Definitely. We
Thank
identify
you.
with what you're doing. Dr. Isa Adamu, Chief of Party, Inspiring Project Save the Children International. Well, the symptoms that you actually just read out, similar to COVID, is really complicated.
We'll leave it there. Thank you so much, Dr. Isa Adamu.
Thank you so much.